How long does recovery from a hemorrhagic stroke typically take? When someone experiences a hemorrhagic stroke, it means a blood vessel in the brain has ruptured, leading to bleeding. The recovery time can differ greatly from person to person. It largely depends on factors like the severity of the stroke, where the bleeding occurred, the size of the hemorrhage, the individual's age, overall health, and how quickly they received medical care. The recovery process is usually broken down into three main phases. The first phase is the acute phase, which lasts from days to weeks. During this time, the focus is on stabilizing the patient, preventing complications, and minimizing any brain damage. Many patients may need intensive care during this period. Complications such as delirium can occur, especially in critically ill patients. Delirium can lead to longer hospital stays and poorer recovery outcomes, which emphasizes the need for careful management. Next is the subacute phase, which can last from weeks to months. In this phase, patients often start rehabilitation to regain lost functions. Many individuals see significant improvements within the first 3 months. However, some may find that their recovery continues beyond this initial period, indicating that functional independence can be delayed. The final phase is the chronic phase, which can extend from months to years. Some patients may keep regaining function and adapting to any disabilities for a year or more. However, the rate of improvement typically slows down over time. Regarding timelines, studies often use a scale to measure how independent patients are after a stroke. About 1/3 of stroke patients achieve a level of independence within 90 days. Others may continue to improve, particularly younger patients with less severe initial deficits and no complications from the hemorrhage. It's important to remember that recovery from a hemorrhagic stroke can be more complex than from an ischemic stroke due to the direct damage caused by the bleeding. The presence of a brain hemorrhage can lead to complications that prolong hospital stays and slow down rehabilitation. To summarize, initial recovery and stabilization can take days to weeks in a hospital or intensive care unit. Significant functional recovery typically occurs within 3 months but can continue beyond that. Ongoing recovery and adaptation might last 6 months to a year or even longer. Factors like age, stroke severity, hemorrhage size and location, complications like delirium, and the quality of rehabilitation all influence how long recovery will take. Because recovery experiences can vary widely, personalized rehabilitation plans and ongoing medical follow-up are crucial. Patients and caregivers should work closely with healthcare professionals to optimize recovery outcomes and address any complications as they arise.